Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Heart failure is scary. Heart failure happens when your heart cannot pump enough blood and oxygen for your body's needs, and a lot of symptoms come out of that. It may be because the heart muscle is weakened. That can happen with age. It can happen from diseases. It can happen after a heart attack. The heart doesn't meet the needs of the body and doesn't support the organs of the body. So heart failure is a serious condition. Your heart's still beating. Now, it's common. Here's some facts about heart failure in the U.S. About 6.2 million adults in the United States have heart failure. In 2018, heart failure was mentioned on 380,000 death certificates. That's over 13% of all death certificates. Heart failure cost the nation an estimated $31 billion in 2012. This total includes the cost of healthcare services, medication to treat heart failure, and missed days of work. So welcome to our episode. Heart failure is very scary, but it can be helped. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the Chief Scientific Officer over here at Invite Health. I want to thank you for tuning in to today's Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. We have over 300 up there now. Please subscribe and please leave us a review. I'd love to know how I'm doing. You can follow us on Facebook, Twitter, and Instagram at Invite Health. The information on this episode is linked at the episode description. So let's get going. So the title of the episode, Heart Failure is Very Scary, but It Can Be Helped. There's reasons it's very scary. And you could be helped beyond the regular medication. And that's interesting. When I was in pharmacy school, people with heart failure typically got a drug called digoxin from a plant, the foxglove plant. And it made them feel better, but it didn't keep them alive. It didn't help survival. It only helped how they felt, their quality of life. The drugs today, drugs like beta blockers like metoprolol, ACE inhibitors like lisinopril, ARBs like losartan, and aldosterone blocking drugs like spironolactone, they actually keep the patients alive as well as improving the quality of life. But there's a lot to say about the drugs, so I'll see how many episodes this conversation takes. It's a very important conversation, and I'll do the drugs in the last episode, because not everybody wants to hear about the drugs. Maybe they're on drugs already. Maybe they're trying to do something else. Like maybe they only have a little bit of a problem with their heart and they want to try supplements. Obviously, severe heart failure, you have to be on drugs. So here's some of the causes, some of the risks why you would develop heart failure. Your heart can begin to weaken as you age. It can begin to fail you. In fact, there's a common situation where fibrous scar tissue builds up in the heart with age. A supplement called ubiquinol has been shown to help prevent that from happening. Ubiquinol is the active version that goes on Q10. I'll go into that a little bit later. But in people with heart failure, ubiquinol it's very promising. It could be very helpful. So your heart can begin to fail you as age, so that's common. Obesity, big risk. It's a big risk factor for developing heart failure because all that extra weight, there's a lot more fluid for the heart to pump around. The blood vessels are stiffening. It's just not good for the heart. Diabetes, another big risk factor. So is sleep apnea. Lung disease can contribute to its development. But many of the people who develop heart failure initially had a problem related to their heart, like high blood pressure they never took care of. Maybe they had a heart attack. Maybe they have coronary artery disease. And that's actually the number one cause of heart failure. Coronary artery disease, your heart has these very narrow arteries in them. Arteries are generally the biggest blood vessels in the body. They carry oxygen-rich blood everywhere in the body. The arteries in the heart are small. And if they get clogged up, that's coronary artery disease or coronary heart disease, it puts a lot of stress and strain on the heart. Everything becomes more difficult. And it's a big cause of heart failure, but it's also a big cause of stroke and heart attack, arrhythmias of the heart, abdominal aortic aneurysms. A lot of bad things come out of it. A birth defect in the heart can cause it to occur in younger people, or a disease that strikes the blood pumping muscle. Now, common symptoms. Talk to your doctor right away if you have some of these symptoms of heart failure. Shortness of breath. It's one of the first signs you may notice, especially after physical activity. And more so than you would normally feel, in other words. Once heart failure worsens, shortness of breath can even occur when you're sitting on the couch. So if you have more advanced heart failure, you don't even have to move around and you can have the symptom. Sometimes you may feel short of breath when you're lying down or sleeping. That's because the heart can't keep up with the blood flow back to it from the lungs. When that happens, fluid leaks into the lungs that will make it harder for you to breathe. Fatigue, very common. You can even feel lightheaded. If your heart isn't pumping properly, the brain takes blood from less important areas of the body, such as your muscles, because you need the blood in the brain for survival. So it could take the blood from your limbs and it brings it to the brain and other vital organs. But once again, you need that for survival. So the body knows how to work with these conditions. So that can make your arms and your legs feel weak. You may feel tired doing everyday things like shopping or walking up the stairs or walking across the room. People with heart failure generally feel tired and weak all the time. Wheezing, nagging cough, that's another sign that your heart is struggling. And that blood returning to it from the lungs is backing up. That means fluid gets into your lungs. Sometimes the cough can bring up, if you're coughing, can bring up like a pinkish mucus. Swelling. So, fluid can back up in your tissues also. So this can cause your feet, your ankles, your legs, or even your belly to swell. The kidneys, since they have less blood to work with, may not get rid of salt as well. So that can raise your blood pressure and that can make your blood vessels squeeze. So this could cause more fluid to stay in your bodies. It's a condition called edema. The amount of salt in the body is normally balanced at 0.9%. And if it's higher than that, there's a ratio of fluid to salt. So if the salt content is higher, you retain more fluid. That's why they give people who are retaining fluid diuretics to help get rid of the salt as well as the excess fluid. You can also suffer with a lack of appetite. This happens because your digestive system isn't getting enough blood and oxygen. You may even feel full. You may feel nauseous. Another common sign if your heart is racing. It's a common warning sign. When your heart doesn't pump enough blood, your body knows it can make up for this in a few ways: by adding muscle to your heart to push more strongly, by enlarging your heart so it can stretch and snap back better, but also by making your heart beat faster to try to get the blood around the body. And confusion, that's another symptom. You may seem confused or sluggish, a little bit disoriented, or you might start forgetting things. So common symptoms if you're developing heart failure: shortness of breath, fatigue, wheezing and nagging cough, swelling, a lack of appetite, confusion. So how do you prevent it? You can lower your odds of getting heart failure if you eat a really good diet with a lot of vegetables and fresh fruits and seeds and nuts and salad and some fish. It's very good for your heart. Plus, when you eat a good diet, you're losing less salt. That puts less pressure on your heart. Frequent exercise. They say about 30 minutes of high quality exercise every day. That could be fast walking, lifting weights, gardening, believe it or not, even vacuuming, walking up and down the stairs, getting on your bike. All of those are considered high quality exercise. Treatment with drugs. I'm really going to cover this in a different part of this podcast. But help with nutrition and lifestyle, very important. Reduce the amount of salt in your diet. This helps reduce swelling and it takes pressure off the heart, but also off your lungs and your kidneys. Unfortunately, these people also are told to drink less liquid. Exercise daily, medication. Unfortunately, if it gets bad enough, you need a heart transplant. A number of nutritional supplements have very good evidence that they can help people with heart failure. I'm going to cover a number of them. I'm not going to cover red beet juice. Red beet is loaded with particular polyphenols called betalains and beta-cyanins, and also something called nitrate. And these help open up your blood vessels so it takes pressure off the heart. They've shown that in people with mild heart failure, you can improve their ability to exercise if you give them some red beet mixed into water before they exercise. B vitamins are very important for the strength of the heart. When somebody comes into me who's had a heart attack or if they have a level of heart failure, I want them on vitamin B1, is very important, vitamin B6, vitamin B12, a type of folate called methyl tetrahydrofolate, and also riboflavin, which is vitamin B2. Carnitine is important for the heart, but I usually give acetyl-L-Carnitine. There's some evidence that the nutrient carnitine is involved with creating not healthy metabolites in the intestines. I don't think it's accurate, but still, instead of giving carnitine, I give what carnitine is turned into, a metabolite of carnitine called acetyl-L-Carnitine, because we get past any pitfalls with the intestines, and it's really good for your brain and brain energy and your memory. It's really good for your hearing. It's really good for nerve health. It's fantastic for the heart. And the more acetyl-L-Carnitine that's in the heart, God forbid you had a heart attack, it helps prevent damage to the heart. It helps lessen damage to the heart. Plus, if somebody had a heart attack, acetyl-L-Carnitine helps restore normal energy production. In a heart attack, the energy pathways are all screwed up. And instead of making carnitines, you make chains of acyl-carnitines that block energy production. And your heart's a super high energy organ. It's beating once every 3/4 of a second, typically 80 times a minute, typically over 100,000 times a day. So blocking up energy channels is ridiculously dangerous for the heart. Alcar unblocks those pathways in the heart. So when somebody comes in who's had a heart attack, I want them on B vitamins, I want them on acetyl-L-Carnitine. In heart failure, they've shown that if you give creatine monohydrate and ribose, D-ribose, it helps the heart. Ribose helps every muscle create energy. It's a type of carbohydrate that doesn't raise your blood sugar, and it helps muscles function. But in people who've had a heart attack or they have heart failure, it makes the heart, it takes away some of the stress in the heart because it makes it easier for the heart to convert sugar into energy, because that's what the heart uses for energy, sugar. And then creatine monohydrate recycles the energy faster. So you have the ribose helping the heart create the energy, and then you have the creatine monohydrate recycling that energy. So it's a good combination for people with heart failure. I generally give them a teaspoon of each, and then maybe the ribose I'll give a second and a third teaspoon over the course of the day, but the creatine just 1 teaspoon a day. Now, before we go into the nutrients big time, let's talk about classifications of heart failure. So, left-sided heart failure. A more accurate way to classify heart failure is by measuring the ejection fraction. That's the percent of the blood that's pumped out by the heart on every pump of the heart, every beat of the heart. So a single contraction, they measure the amount of blood left over and the amount of blood pumped. So the ejection fraction as a percentage with the normal range is between 50 to 75. So, typical would be 60. So that means your heart's pumping out oxygen-rich blood. And let me explain how the heart works. But the heart pumps out oxygen-rich blood from the left side of the heart through arteries around the body. So your brain gets oxygen, your muscles get oxygen, your kidneys and your liver and all your organs get oxygen, your legs get oxygen. And it's supposed to pump out typically 60% of the blood, so there's 40% left over. And heart failure, it's kind of just the opposite. It might pump out 40% of the blood, 60% is left over. So that accounts for all those symptoms like fatigue and weakness and brain fog, etc. So here's how the heart works. They talk about the right side of the heart and the left side. After oxygen is taken out of the blood, they call it blue blood. And it's restored back to the lungs by little blood vessels, smaller blood vessels called veins. And then the lungs enrich it with oxygen. To get it to the lungs, it goes through the right side of the heart. The right side of the heart. It goes into the upper right part, and then the lower right part of the heart pumps it into the lungs. From the lungs, there's 5 veins, the pulmonary veins, that go into the heart, the left chamber of the heart. So the left top chamber fills up, it goes down to the left, it empties to the lower chamber, and in that lower left chamber pumps out the blood. So that lower left chamber is where all the action takes place. So that's a very important part of the heart. So they look at left-sided heart failure. In the left-sided heart failure, it's failure to pump out the blood adequately to your body. When it's right-sided heart failure, the blood is backing up in the area that collects used blood. But then there's congestive heart failure. Fluid is backing up into your lungs and tissues. So I'll go into that a little bit. There's two types of left-sided heart failure, and I'm sorry for getting into this a little too deeply, but people with heart failure or they have a relative with heart failure, they really want to know these things. So there's two types of left-sided heart failure, and mind you, the left side is the part of the heart, the side of the heart that pumps oxygen-rich blood up to the brain and around the body. Drug treatments are different for the two types. So there's heart failure, left-sided heart failure with reduced ejection fraction. That means the heart's not pumping enough blood out. It's only pumping about, maybe 40% or less of the blood, and all the rest of the blood is left behind inside the heart. So these people get all the symptoms. Then there's left-sided heart failure with preserved ejection fraction. The left ventricle, the bottom part of the left chamber that pumps out the blood, it's losing its ability to relax normally because the muscle has become a little stiffened, a little thickened, a little stiffened. So the heart can't properly fill with blood during the resting period between each beat. So you see that there's two different things here. And one, it can't fill properly, and the other, it can't pump properly. That's why they use different drugs. So that is right-sided heart failure. So the right side takes the used blood and pumps it into the lungs. So it could be replenished with oxygen. And then, like I said, it goes into the left side and that pumps it out to the body. In the right-sided heart failure, it usually occurs because of the left-sided heart failure, and the fluid is backing up. The fluid is backing up near the lungs. And then there's congestive heart failure. It's a type of heart failure, it's dangerous. Blood flow out of the heart slows, and blood returning to the heart through the veins backs up. This causes congestion in the body's tissues. So fluid can collect in the lungs, it's interfering with breathing, it's causing shortness of breath, especially when a person is lying down. This is called pulmonary edema. Left untreated, it can cause respiratory distress. Now, heart failure also affects your kidneys because they can't dispose of salt and water. And this retained water also increases swelling in the body's tissues. They classify heart failure according to the New York Heart Association functional classification. So there's level 1, level 2, level 3, level 4. And level 1, no limitation on physical activity. Ordinary physical activity isn't causing undue fatigue, severe fatigue, or weird beating patterns of the heart, palpitations, or shortness of breath, which we call dyspnea. And stage 2, there's a slight limitation in physical activity. You're comfortable at rest. You're comfortable sitting on the couch watching TV. But during normal physical activity, you could feel fatigued, you can have palpitations, you could develop shortness of breath. So just walking to the store can cause fatigue and trouble breathing. At stage 3, now it's getting dangerous. In stage 3, there's marked limitation of physical activity. You could be comfortable sitting on the couch, but mild physical activity, getting up and going to the refrigerator, can cause fatigue and a rapid heart rate and shortness of breath. Level 4 is considered terminal. I hate to say it. People are unable to carry on any physical activity without discomfort. Symptoms of heart failure at rest. Just sitting on the couch, you're out of breath, you're fatigued. Here's the thing. They are showing that you could, with certain nutrients, take people in level 4 and bring it down to like level 3 and possibly even level 2. We'll go into that. So, let's stop this now, and I'll come back and I'll do a part 2 of this podcast. I'll do a second episode where we talk about supplements.